Hi, I'm Erika Mumford, and this is the treatment group video for schizophrenia spectrum and psychotic disorders. My client is Mark Treacher, who is 22 years old. The differential diagnosis that we considered for Mark were schizophrenia and schizophreniform disorder. Ultimately, we ruled out schizophrenia because he's been symptomatic less than 6 months. And we ruled in schizophreniform disorder because he's had delusions and hallucinations for more than a month, but less than 6 months. The primary diagnostic features for schizophreniform disorder are that a person with this disorder experiences delusions, hallucinations, disorganized speech, disturbed or catatonic behaviors, flat affect, or severe lack of motivation. And the second feature is that these symptoms are experienced for at least a month, but not longer than 6 months. Okay, getting into Mark's story, Mark was very close to his mother and she died 5 months ago. But prior to her death, he lived a really normal life. He was in college and working at a fast food place. His father said that Mark mourned his mother normally up until 2 months ago when his girlfriend left him for another man and he became disturbed. Mark started to believe that there was a baby growing inside of him and that baby was going to be the reincarnation of his mother. He states that he was visited by an old sage that told him he was going to be in charge of raising his mother, and if he did a good job, he'd have good luck and his mother would return to the family. He also claimed that Katie Couric wanted him to appear as a guest on her talk show to talk about this story. When telling the story, Mark's speech is very rapid and he has difficulty focusing and staying on topic. His father notes that Mark seems to have like an ongoing dialogue with someone who isn't in the room. And when we ask Mark who he's talking to, he says it's his spirit guide who is helping him to, quote, grow mother properly. He's seeking treatment because he said that his father said that he needed medical treatment to ensure the safe delivery of his baby. He doesn't believe there's anything actually wrong with him. In school, Mark was never a good student. His social life seemed to be the most important to him. He had a lot of girlfriends and was really popular, and his most recent relationship lasted about a year. He was really distressed when he broke up, and he kept telling his father that he thought that she was the one and they were going to get married. He's never had any other psychological problems that required treatment, and even though he admits to using alcohol and marijuana recreationally in the past, he doesn't indicate any drug or substance abuse currently. His deterioration has resulted in him dropping out of college and quitting his job because he's no longer able to work. Mark is the youngest of 4 children, and we find out that both his parents met when they were patients in a psychiatric hospital. It's not clear what either of them were being treated for, and Mark's father isn't very forthcoming about what he was institutionalized for. Moving on to the multi-axial diagnosis, in Mark's case, on axis 1, we place schizophreniform disorder. Axis 2 and 3 are none. On axis 3, it's important to note the recent death of his mother and that his girlfriend left him for another man. And on axis 5, we gave him a GAF of 30. There's only one theoretical perspective to consider in Mark's case, and that's the biological perspective. The client may have an excessive amount of dopamine or a lack of glutamate, which would bring on the psychotic symptoms. The client may have a genetic predisposition for developing schizophrenia, and people with schizophrenia usually have enlarged ventricles, which are indicative of cortical atrophy. All right, thank you.